Hello everyone, now let us discuss about some of the disorders and diseases of urinary system. First of all, we will be discussing the glomerular diseases. A variety of conditions may damage the kidney glomeruli, either directly or indirectly because of a disease elsewhere in the body. And typically, the filtration membrane sustains damage and its permeability increases. First of all, coming to glomerulonephritis. As the term indicates, it is the inflammation of the glomerulus. Inflammation of the kidney that involves the glomeruli. One of the most common causes is an allergic reaction to the toxins produced by streptococcal bacteria that has recently infected another part of the body, that is especially throat. Majority of the throat infections are caused by streptococcal bacteria. And in glomerulonephritis, the glomeruli become so inflamed, swollen, and engrossed with blood that the filtration membranes allows blood cells and plasma proteins to enter the filtrate. As a result, the urine contains many erythrocytes and it causes hematuria and lot of protein which causes proteinuria. And the glomeruli may be permanently damaged, leading to chronic renal failure. The next term is nephrotic syndrome. The nephrotic syndrome is a condition characterized by proteinuria, which is nothing but protein in the urine, and hyperlipidemia, that is high blood levels of cholesterol, phospholipids and triglycerides. The proteinuria is due to increased permeability of the filtration membrane, which permits the proteins, especially albumin, to escape from blood into urine. And loss of albumin results in hypoalbuminemia. Low blood levels of albumin. Once the liver production of albumin fails to meet the increased urinary losses, this leads to low levels of albumin in the body. The next is edema, usually seen around the eyes, ankles, feet and abdomen. It occurs in nephrotic syndrome because of the loss of albumin from the blood decreases the blood colloidal osmotic pressure, due to which edema may result. And it is also associated with several glomerular diseases of unknown cause, as well as with the systemic disorders such as diabetic mellitus, systemic lupus erythematosus, and a variety of cancers and AIDS. Now coming to renal failure. First of all, let us discuss about acute renal failure. The renal failure in general is decreased or cessation of glomerular filtration. In acute renal failure, the kidneys abruptly stop working entirely. The main feature of acute renal failure is the suppression of urine flow, usually characterized either by oliguria, daily urine output between 50 to 250 ml, or by anuria, that is daily urine output less than 50 ml. And the causes include low blood volume, for example due to hemorrhage, decreased cardiac output, damaged renal tubules, kidney stones and dyes used to visualize the blood vessels in angiograms, non-steroidal anti-inflammatory drugs and some antibiotic drugs. It is also common, the acute renal failure is also common in people who suffer a devastating illness or overwhelming traumatic injury. In such cases, it may be related to a more general organ failure known as multiple organ dysfunction syndrome, MODS. And renal failure itself causes a multitude of problems. The first one is there is edema due to salt and water retention. Metabolic acidosis can occur due to the inability of kidneys to excrete acidic substances. In the blood, the urea builds up due to impaired renal excretion of metabolic waste products. Potassium levels rise, which can lead to cardiac arrest. Often there is anemia because the kidneys no longer produce enough erythropoietin for adequate red blood cell production. And because the kidneys are no longer able to convert vitamin D to calcitrol, which is needed for adequate calcium absorption from the small intestine. Osteomalacia may also occur. Now coming to chronic renal failure. It refers to a progressive and usually irreversible decline in glomerular filtration rate. The chronic renal failure may result from chronic glomerulonephritis, pyelonephritis, polycystic kidney disease, or traumatic loss of kidney tissue. And the chronic renal failure develops in 3 stages. This is, we are talking about clinical point of view, but from medical coding point of view, there are total 6 stages. So the chronic renal failure develops in 3 stages. In the first stage, diminished renal reserve. Nephrons are destroyed until about 75% of the functioning nephrons are lost. At this stage, a person may have no signs or symptoms because the remaining nephrons enlarge. They undergo hypertrophy and take over the function of those that have been lost. Once 75% of the nephrons are lost, the person enters the second stage called as renal insufficiency, characterized by decrease in glomerular filtration rate and increased blood levels of nitrogen containing base and creatinine. Creatinine levels are a function test for kidneys. Levels of creatinine are used to estimate the renal efficiency. Also, the kidneys cannot effectively concentrate or dilute the urine. And final stage, the final stage is called as end stage renal failure. It occurs when about 90% of the nephrons have been lost. At this stage, glomerular filtration rate diminishes to 10 to 15% of normal. Oliguria is present and blood levels of nitrogen containing base and creatinine increase further. People with end-stage renal failure need dialysis therapy and are possible candidates for a kidney transplant operation. Now coming to polycystic kidney disease. The polycystic kidney disease PKD is one of the most common inherited disorders. In PKD, the kidney tubules become riddled with hundreds or thousands of cysts. In addition, inappropriate apoptosis, that is programmed cell death. Apoptosis is nothing but cell death. Programmed cell death of cells in non-cystic tubules leads to progressive impairment of the renal function and eventually to end-stage renal failure. And people with polycystic kidney disease also may have cysts and apoptosis in the liver, pancreas, spleen, and gonads. They have an increased risk of cerebral aneurysms, heart valve defects, and diverticula in the colon. And typical symptoms are not noticed until adulthood, when patients may have back pain, urinary tract infections, blood in the urine, hypertension, and enlarged abdominal masses. Using drugs to restore normal blood pressure, restricting the protein and salt in the diet, and controlling the urinary tract infection may slow the progression to renal failure. Now let us see some of the terms and conditions that we have now discussed earlier. First term is azotemia. Azo means nitrogen. Emia means containing condition of blood. Azotemia is presence of urea or other nitrogen containing substances in the blood. The next is cystosis. Cysto means bladder. Cili means hernia or rupture. Hernia of the urinary bladder is called as cystosis. The next is diabetic kidney disease, a disorder caused by diabetes mellitus in which the glomeruli are damaged, results in the leakage of proteins into urine and reduction in the ability of the kidney to remove water and waste. The next condition is hydronephrosis. Hydro means water, nephros means kidneys. Osis is condition. Swelling of the kidney due to dilation of the renal pelvis and calyces as a result of an obstruction to flow of urine. It may be due to congenital abnormality, a narrowing of the ureter, a kidney stone, or an enlarged prostate. The next term is stricture. Narrowing of the lumen of the canal or halo organ such as ureter, urethra, or any other tubular structure in the body. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.